to an introduction to magnetic needle navigation, eSpacial Navi by Mindray Ultrasound. My name is Mark Escarceta, and I am an ultrasound product specialist with Mindray Distribution and the managing partner of Mark II Medical. I can be reached at mark@mark2medical.com or call my cell anytime, 619-347-5314. Today we're going to be talking about eSpacial Navi, also known as eNavi, and that is 4D magnetic needle navigation technology created by the fine folks at Mindray North America. Why eSpacial Navi? Well, for one, it's an excellent educational tool. So for all of you instructors out there, wait till you see what this thing can do and how it can speed up that learning curve. Speaking of learning curve, this is also great for beginners. One of the challenges of ultrasound needle guidance is learning how to properly line up the needle with the sound beam that's coming out of the probe. And when you're talking about something that's micrometers thick, it can be quite challenging. So we're going to be able to help you with that. The other reason, which I think is the most important, is that for all of you seasoned veterans out there, it's going to allow you to approach a needle injection, a needle placement, in more, let's say, daring and bold approaches, because it's going to add a fourth dimension to visualization that you didn't have before. So the principles of eSpacial Navi, it's actually quite simple. There's an embedded magnetic sensor in the probe, and we have a passive magnetizer. And we also have a bunch of math and a bunch of physics and all that other stuff that I kind of don't understand. But in a nutshell, what you basically have is you have a probe, which you're all very used to by now. And what we did is we put this little sensor inside that can pick up on magnetic interference and project those results on the screen. And that's kind of what you're seeing now. We'll get into the details of what all those dots mean and what that weird blue box is later. But in a nutshell, it's going to project that image onto the screen. And it's going to give you all kinds of great information. So let's take our magnetized needle. Actually, first of all, let's go ahead and let's try to find ourselves a target. And I know my phantom pretty well, so let's just go ahead and let's start by going for this nice juicy artery right here. And for the sake of this exercise, let's not stick the artery. Let's go just underneath it. So please follow all instruction on how to properly hold a probe. What I've been taught is to try to make sure that your hand is touching your patient so that you're not slipping around too much. You want to have it kind of loose because you want to be able to rotate the probe in all these axes. You want to be able to fan it like this, heel toe it like this, and rotate it like that. You also want to be able to slide it back and forth, north and south, east and west. So let's get our target centered. Now, when you don't have fancy gadgets like magnetic needle navigation, you tend to want to bring your target closer to you. And that's usually a really good idea because it's less, there's less distance there. It's a little bit easier to hit. But sometimes it means that you're going to put a lot more angle onto your needle. So centering it sometimes allows you to flatten that needle angle a little bit, which makes it a little bit easier to see. And again, for the sake of this exercise, we're just going to space it out a little bit because I really want you guys to see magnetic needle navigation working. Okay, let's take our needle, and right now it's magnetized. So when I bring this needle close to the probe, it's already given me information. Now look, I am just moving the needle back and forth, and you can see that it's already it's doing something, right? You see those blue dots. And what those blue dots are telling me is that basically if I just stopped right there and I push my needle forward, it's going to follow along that trajectory. So it allows you to make those adjustments before you break skin. And that's a big advantage when you're talking about a patient here. You don't want to, you don't necessarily know everybody's pain thresholds, and you know, the less poking, the better. And also the less that you're kind of messing around in there, the better. So what if you can know exactly where this needle is going to go before you break skin? Well, that's what this tool is designed to do. And so let's take our magnetized needle and let's bring it closer to the probe. And now let's use some of those tools that we were talking about earlier. And let's go to a quick review. So again, what we have here is this right here, these dots right here, this is telling you where, this is the trajectory of your needle. Okay, so the large dots represent a centimeter and the small dots represent a millimeter. Okay, so you can tell how far away you are too. As we get a little bit closer, you're also going to see that you have the small box right here and the large box following it, and this is always going to be in the long axis. You're going to have a small box on top of underneath a large box, and it's going to all be with these beautiful dots showing you the way. Now, the color that this is also another tool that you can use that can really help you with needle navigation. Notice how right now it's a little bit, now it's blue and now it's turning yellow. So another thing that I want to draw your attention to is let's go back to that aerial view of your probe head, and that's down here at the bottom left corner. That yellow line right there represents where the needle is in relation to the probe itself. And let's see if you can see it here on the live model. But the needle right now is just a little bit to, on the model, it's to the east. But on the ultrasound, it's a little bit too far to the north. So it really depends on, again, this is how you are oriented to your patient is going to be how it's represented on the screen. We have an extra challenge because the way that I'm filming this, it's actually upside down for me. So I might get left and right confused, so please excuse me. But the way that this is going to help us right away is keep your eye on this bottom left corner right here, because that is the head of the probe. That line on top, that orange line, is where the needle is right now. And if it's orange, what that is telling you is that you are not lined up with the sound beam. So for all of you newbies out there that are having trouble seeing your needle, chances are you're just not lined up with the ultrasound beam. And that's a real challenge. It takes a lot of practice, but with this can really shorten that learning curve. Also notice that our box right here is also orange. So this color is going to correspond with the needle color that is represented down at the bottom. Okay, so now that we know our tools a little bit better, let's go ahead and get this guy working. Okay, so I'm going to take my magnetized needle and I'm going to bring it right back to the very edge of my probe. Now I'm not really inside the skin yet, just for demonstration purposes. I'm just kind of a little bit there so that I can just kind of brace it just for a second so I can talk. But normally you're not going to really want to touch this to the patient until you're ready to inject. But as soon as I get close, notice I'm backing my hand up, I'm getting it closer, I'm backing my hand up, getting it closer. Notice it's already given me all that really valuable information. So I'm going to try to not put a hole to stick that artery. So I'm going to try to go right underneath it. So it's really important that you line up with your needle, okay? And it's important that you also that you get the angle that you want, but that it's also blue. So right now it is blue. I am lined up perpendicular to the sound beam. The needle, I'm sorry, not perpendicular, parallel. The needle and the sound beam are parallel when you're in the long axis like this and it's blue. If I slide my probe For me, it's to the left, but for you on the screen, it might be to the right. But right now, it's making that needle go south on the ultrasound image. So I'm going to now move my probe this way, and you're going to notice that it's also changing color. And that means that I'm lined up. So I'm going to go ahead and advance it, okay? And sometimes, you have to get used to kind of maintaining that angle. And there I am, right where I need to be. And I can see that probe, that head of the needle is just touching the line of that small box. So there's always going to be a little bit of variation as to where the needle sits. It has to do with how good contact you got with the magnetizer, the size of the needle, the variations in the tissue. So there's going to be some small variance when it comes to being inside of that box. But for the most part, you can have a pretty high confidence level that that tip's going to be there when you need it to be. Okay. So let's go over again what happens if I slide the probe that way. Notice how it's bright yellow, and I don't see my needle at all. So now I'm going to slide the probe back down the opposite way, and it's going to allow me to see that needle a little better. Now, we know that that needle is there. And just to help out a little bit, what I would also like to show is needle visualization. So let's go ahead and turn that on. Needle visualization might be a feature that you're a little bit more used to. And what this is, it's kind of beam steering in a way. As you may know, just general physics, when the ultrasound beam is coming from the probe down to the structure, you're perpendicular to the structure. But as you insert a needle, that needle is no longer perpendicular to the probe. And what happens is, as you put more angle, as you go deeper, that sound beam gets deflected off of the needle and it doesn't get returned to the probe. And of course, we all know that's how sonar works. And so if the sound doesn't come back to the probe, it just doesn't think it's there. And so what needle visualization does is that it basically acts like if there's a second probe that is now perpendicular to the needle. So in this case, what we're looking at is we have a sound beam coming perpendicular, so north and south. And we also have a second sound beam that is coming in at about a 45-degree angle. And that's what's helping us see the needle itself. Okay, so let's talk about magnetic needle navigation in the short axis. It's also known as the out of plane. This is a very, very versatile approach. It allows you to work in very small spaces. It allows you to come right up on top of your structure and really drop that needle in there. But this takes a lot of skill. Ask your instructors about it. I'm sure they'll tell you. And one of the negatives to this approach is that you just don't know your depth of the needle, because what's happening here is that the short axis of a needle under ultrasound, it's just going to look like a dot on the screen. So let me just show you a short axis image without any of the fancy gadgets, just so that you can see what I'm talking about. So let's go back to our artery. Now I'm going to use that same needle. It's probably still magnetized, but I turned off the feature. And let's just insert it, and I'm going to try to hit that artery. I'm going to try to hit it this time. So I'm going to kind of guess. I'm going to put a tilt on it right there. That's probably a little too much. I'm going to center it right there. And oh, nope. See, so I didn't even come close to it. You can see the tip of the needle up at the top. I know it's the tip because I'm just barely able to see it. Now, the negative with short axis is that if I advance this needle more, that movement up at the top is no longer the tip of the needle. That is the shaft of the needle. I've already passed it. So you don't have that fourth dimension when you're looking at short axis. Well, not any, well, now you do. So as I bring this needle close, I already have some valuable information. So notice how if I'm moving my needle up and down, it's moving that box side to side, okay? And up and down is all relative. It depends on where your patient is and how you're holding the probe, but I'm sure you can see how this is relating. So with all those indicators and all those tools, what you really need to know is wherever that box is, that is where the needle tip will go. So if I want to be really bold and aim for a really small spot at a short axis, and if I know with certainty, almost 100%, that it's going to go there, I need to use eSpacial magnetic needle navigation. So right now, I barely have the needle pressed up against my my phantom model. And that right now, if I was to advance my needle without changing the angle, that needle is going to end up right in the middle of that artery. Let's pay attention to those circles and dots. Every large dot is a centimeter, every small dot is a millimeter, and I'm going to go ahead and push it forward. And you're going to see the two lines at the top, which is really just the end of the large box, are starting to get closer. Also look at your alignment indicator at the bottom left corner. Notice you see the head of the probe in relation to the needle. And right now the needle is coming at what? The short axis. And right now it's orange. Orange is telling us that we're not quite at the tip yet. When you're dealing with the short axis, what you want is to get that thing to be blue. And so as I'm starting to advance the needle really slowly just so that I can talk and explain it. But as I advance the needle really slowly, you can start to see the boxes are changing color and that needle in the alignment indicator is also changing. And when those two lines touch, it's going to turn bright blue and I am going to see my needle tip right in my target. 100% accuracy. Now, remember what I was telling you about that fourth dimension? Well, right now I am seeing the tip of my needle. But if I advanced my needle forward, notice how it still looks like a dot in the screen, but it's orange and the large box has enveloped the small box. And so also look at the alignment indicator at the bottom. It's telling you that you overshot and that's no longer the tip. So pull it back and now it's blue again. And now you can inject with 100% certainty that you're in the right spot. Great for beginners, absolutely. Great teaching tool, absolutely. But what I'm interested in is to see you salty veterans out there. I'd love to see what you guys can do with 4 dimensions of ultrasound needle guidance. Thank you all for attending this short talk, An Introduction to Magnetic Needle Navigation, eSpacial Navi by Mindray Ultrasound. Once again, my name is Mark Escarceta, and I am with Mindray Distribution and principal partner at Mark II Medical. I can be reached at mark@mark2medical.com, and I can be texted or called anytime on my cell, 619-347-5314. Give me a call if you would like to set up a virtual demo. We can get more into the specifics and see how magnetic needle navigation can help you help your patients. Thank you again. Have a good day.